Hello viewers, we will talk about oral pre-malignant lesions today. So there are two things important here. One is what is oral cavity and what is pre-malignant lesion. So what we mean by oral cavity? The inner surface of the lips, teeth, gums and the interior part of tongue and hard palate. They form the oral cavity. And the rest of the things which we see after opening the mouth, if you open your mouth in front of your mirror, those are called oropharynx. So what is pre-malignant lesion? So pre-malignant lesion is a disease or syndrome. If that is untreated, that can lead to cancer. So what are the oral pre-malignant lesions? So if you have something in the oral cavity which can give rise to cancer later on, that is called pre-malignant lesions of the oral cavity. So it generally affects 2.5% of the general population. So oral pre-malignant lesions are a group of diseases which are potentially malignant. So they can be an important target for cancer prevention. So what are the common pre-malignant lesions we see in the oral cavity? Leukoplakia, erythroplakia, proliferative verrucous leukoplakia, lichen planus, oral submucous fibrosis. And we will talk about all of them gradually and slowly. So how these pre-malignant lesions are developed? It can be idiopathic. That means all the reasons are not well known. But tobacco smoking, tobacco chewing and alcohol are important risk factors. If any lesion in the oral cavity is bigger than 200 mm square, it can be dangerous, it can be potentially malignant. Apart from leukoplakia, erythroplakia and proliferative verrucous leukoplakia, the most important pre-malignant lesion of the oral cavity is oral submucous fibrosis. This is prevalent in the area where people chews tobacco and chews erica nuts or supari. In this condition, there is a progressive fibrosis of the deeper tissues of the oral cavity. The patients are coming with inability to open their mouth, and there are whitish bands inside the mouth cavity in the palate, tongue and cheeks. Oral submucous fibrosis can be prevented if you do not chew tobacco in any form. And once you have already developed oral submucous fibrosis, it can be initially treated medically and later can be treated surgically. The treatment is very important because oral submucous fibrosis itself can lead to cancer, and because of inability to open the mouth, already developed cancer can be overlooked. So which of the lesions are having more malignant potentials? Erythroplakia, proliferative verrucous leukoplakia. If the lesions are in the tongue or floor of the mouth means the area which is deep to the tongue. And if the lesion has developed in a non-smoker, if your doctor says that biopsy is needed, go for that. You might think that biopsy will spread your disease. No, it is not. Biopsy can diagnose the disease at an earlier stage, and nowadays all early cancers of the oral cavity can be treated very easily. A question which is often asked, whether this pre-malignant condition can be prevented. Yes, this is still in a research state, but turmeric, vitamin A and other retinoids which are widely available in carrots and all colored vegetables, vitamin E, they can do some chemo prevention for this oral pre-malignant lesions. And once they have developed, like leukoplakia, erythroplakia or proliferative verrucous leukoplakia, they can be treated with various surgical options like carbon dioxide laser, surgical excision, bioelectrosurgery, and it can be cured. So how can we prevent oral pre-malignant lesion? We can keep our mouth cavity clean. And if anything has developed, any patch, might be white, might be of different color, might be at the same level, might be elevated. If that is there for a long time, you should visit your doctor. And if your doctor suggests biopsy, do that to rule out malignant transformation. And if you keep your mouth cavity clean, if you do not use tobacco in any form, especially if you do not chew tobacco, if you do not chew areca nuts or supari, you can prevent oral submucous fibrosis also. And once you develop, if you are diagnosed, go to the doctor, treat it. And if you can treat oral pre-malignant condition, you can reduce the incidence of cancers of the oral cavity. Thank you.